This is Brent of the Brookbush Institute, and in this video we're going to go over rectus femoris and quadriceps vibration or percussive release using the Hypervolt from Hyperice. I'm going to have my friend Melissa come out. She's going to help me demonstrate. Now this is a release technique, so I'm going to assume we're trying to increase mobility and that is based on assessment. So if we're doing the quad and rectus femoris, I'm going to assume that maybe she either has a hip extension or knee flexion restriction. Maybe on the overhead squat assessment she had excessive forward lean or knees bow out or an anterior pelvic tilt, but we have a good reason to do this and something to reassess to see how effective this technique was. Now you'll notice that Melissa is in supine on a table. That does have some advantages because I can actually have Melissa scoot over just a little bit and then hang her leg off the table, and by bending her knee like this I can actually put my knee against her shin and control the amount of tension in her quad and rectus femoris. This is going to come in handy because with my release techniques I want the tissue to push back against the machine just a little bit, and putting a little stretch in the tissue might actually help us get a release, right? Like you guys have noticed, like when you stretch you get that release of tissue. So a little counterintuitive with our vibration release techniques is we actually start on the higher settings, but we are going to start very superficial. So what I'm going to do is I'm going to start down by Melissa's knee here, and you guys got to be careful because some people are a little ticklish down here, right? And I'm just going to slowly glide through the tissue. A little different than our static manual release techniques or our foam rolling where we're going after a specific trigger point. In this case, I'm going to actually kind of go through all of the muscle. I think you'll find that you get a good release throughout the entirety of the muscle tissue. It's a little less specific than that trigger point release techniques. However, as you're going through, try to make note of where the tissue feels a little denser, right? It's a little harder to push through. Maybe where you're getting some twitch responses. Like every once in a while you will hit a trigger point and you'll see fibers or fascicles actually twitch. Or places where the patient or client says that they're more tender. All of those are going to be good places to go back to when I show you guys how to use this technique or modify this technique to get a little deeper in the tissue. And Melissa's kind of kicking back against me here, so I'm guessing that this is a tender spot. We'll kind of make mental note of that for later. And as I'm going through, you guys will notice I'm staying away from her kneecap. I'm also staying away from her ASIS. This thing does not feel good over bony protuberances. If you're a little unsure of somebody's anatomy, you could always put a thumb there, right? Or put a thumb there and make sure, you know, you don't go past your own thumb. You guys will notice I'm just using the weight of the machine here. I don't need a lot of pressure. And nice, the Hypervolt is light enough that I can use one hand. I could even be like monitoring or trying to palpate tissue and see where she has maybe the most restriction, like is it mostly in her rectus femoris as opposed to like more of like the top of her vastus lateralis. All right, so we'll say that we've gone through her whole muscle here. Right now maybe I want to get a little deeper into the tissue. Well, I can try with this piece, although this piece is pretty wide and flat. I might want to go with something that has a little smaller surface area. The Hypervolt comes with these two pieces. This one's kind of forked like, so you could, I guess, essentially go after two trigger points at once. It does come in handy. This piece is what we're going to start with here, which I think Hypervolt calls the bullet. And since I'm going to try to get a little deeper in the tissue, I might also do this. Take some tension out, right? Now I can get a little deeper without getting kickback from that tissue. I'm also going to start at a lower setting. So maybe I use 2. See if Melissa can stand this. Not so well. Let's see if she stands the lower setting a little bit better. All right, so let's try this. Is that better? Okay. So we're just going to use that lower setting. And as I mentioned, I kind of kept track that like she had a tender point here. So maybe I'm going to slowly glide through that tender point. Right? Wait for that tissue to give way. You guys notice that where I was really superficial with that flat piece, I'm kind of digging in a little bit. Don't press as hard as you possibly can. We're not trying to strike her femur. Like, that's definitely not the goal. You're just digging in a little bit and then slowly working your way through the tissue. Got a little bit of a twitch response there as that trigger point let go. All right. And as we get higher into her quad and we're getting into like thicker, more dense muscle tissue, we could have Melissa sit up. Right? So now we're shortening the rectus femoris even more. And maybe that allows us to get even deeper into the tissue if we feel like we have a really deep trigger point. And of course, the nice thing is since this is a very safe technique, guys, you can't really do much damage. If you do have an athlete who's coming in often and you feel confident in their ability and want to do this effectively, let's say I wanted to go grab a couple pieces of equipment to set her up with like maybe her isolated activation techniques, I can go, here you go. Make sure you work on that area where you have those tender trigger points, and of course she can feel those trigger points probably better than I can, right? If she was a really advanced athlete, elite athlete, competition and recovery was really, really important to her, I might even suggest that she purchases one of these for home, because the quads are definitely an area that somebody can get to on their own. I know personally I use this after every basketball game. It's definitely convenient to kind of just be doing on the ride home, just be like going through my quads and making sure I get a little bit of that help on the recovery side of things. How's that feel?
Good.
Ticklish?
Little.
Yeah, this is one area that Melissa is quite ticklish on. I know some people are a little bit more ticklish to the vibration and in a little different areas than others. Good, how does that feel? Good?
Good.
All right, so we'll go ahead and turn this off. All right, and then I would follow up with reassessment. So if we're doing the quad, maybe I want to retest knee flexion. If we were doing this for hip extension, maybe I want to retest her hip extension. Maybe I want to look back at her overhead squat. Remember guys, we're not just using a cool tool to do a cool technique, we're trying to get some sort of effective outcome. So to quickly go through all of the progressions we went through, can you lay down real quick? We had several positions. We had knee bent off the table, and of course I could control how much knee bent. I then went a little deeper or got a little less tension in the tissue by putting her leg straight. But notice she's still in a hip extended position, or at least a hip neutral position. I could then have her sit all the way up. I have different heads that I can use for the hypervolt, right? I told you guys that I like the flat round piece for lower extremity in particular. I think it gives a very consistent feel, being that it's a solid piece and it has a good surface area to it. And then once I was going after more like trigger points and specific points of tissue density, I switched to the bullet, although you could probably also get away with using this tool, which is kind of like this fork-shaped tool. Start with assessment, follow up with assessment. I hope you guys really enjoy this hypervolt from Hyperice. It's definitely a game changer.